Welcome to At Home and Abroad with Harris and Walker. Join us each week as we follow our curiosity, diving deep into the familiar and the foreign. Reach beyond your front door as we uncover new perspectives, explore intriguing ideas, and have real conversations with the best guests. Ready for something different? Let's get started. Writer Felicia Sabertinelli has suffered with allergies for most of her life. Her allergies are so extensive that she refers to herself as Miss Allergic to Everything. As a child, she experienced terrible hay fever, not the best affliction for someone who grew up on a hay farm. But this was only the beginning. In Felicia's early 20s, she was diagnosed with oral allergy syndrome, a condition that forced her to eliminate fresh fruits and vegetables from her diet. Around the same time, she was also diagnosed with an allergy to fish and nuts. In her 30s, additional allergies were identified. Today, in addition to the fresh fruits and veggies, she is allergic to walnuts, peanuts, almonds, pistachios, pecans, cashews, and coconut. She is also allergic to shrimp, egg whites, corn and corn products, soy, barley, rye, all legumes, yeast, garlic, mustard, sesame seeds, and ginger. Felicia also has environmental allergies. She is allergic to all trees, grasses, weeds, and pollen. And yes, to cats and dogs too. Living with her extensive allergies is not easy. She has confessed the inability to eat healthily and even enjoy food is a constant stress in my life. Often I'm filled with anxiety, especially when I try to eat out with my friends or family, or even while traveling.
I can't even imagine how difficult that must be for her, though I have known one or two people who have had to manage a similar set of allergies, and it was really stressful.
Of course, allergic reactions can be life-threatening.
Yeah, they can, and I'm really grateful that my children were not severely allergic to anything. We were lucky.
Oh, me too. It's so difficult to completely avoid some foods as they can be hidden ingredients. It would cause a lot of anxiety.
Yeah, and of course, allergies are not limited to foods. People can be allergic to environmental allergens such as pollen, medicines like penicillin, chemicals, and even metals. One child in my kid's school was allergic to the sun. That was a bit of a tough one.
Wow, hard not to come into contact with the sun.
Yeah, just having the sun touch his skin would have resulted in a severe rash. And your skin can also react to all manner of environmental allergies. Just think of what occurs when you're bitten by a black fly or a mosquito. And I have about 25 examples I could show you right now, Walker.
Yikes.
Of course, allergens can be inhaled too, as in the case of pet dander and the proteins and dust that comes from dust mites. But food allergies can also be triggered by inhalation. Even one bag of peanuts opened on a plane can impact someone with a severe nut allergy. And of course, allergies can be set off when an allergen is ingested, of course, like in the case of food or medicine.
So what exactly is happening when our bodies are allergic?
Well, according to the Mayo Clinic, when you're allergic to something, your immune system mistakes a normally harmless substance for a dangerous invader. The immune system then produces antibodies that remain on the alert for that particular allergen. When you're exposed to the allergen again, these antibodies can release a number of immune system chemicals, such as histamine, that cause allergy symptoms.
A lot of us have experienced an allergy of some kind in our lives, but did you know that in the US, 20 million people were said to have food allergies as of 2021?
That's a lot of people. So are you allergic to any foods, Walker?
Oh, luckily no. What about you?
No, thank goodness. I have a gluten sensitivity, but it is really easily managed. And I am thought to be allergic to penicillin.
Yeah, it would be so difficult to have a severe allergy in the family. You would be on high alert at all times, constantly scanning our environment for risk of contact.
Yeah, so stressful. And it can lead to anxiety and depression too.
Well, that does not surprise me at all.
And not all people take allergies seriously. According to professional counselor Dr. Taish Malone, many fail to realize that having allergies is a medical condition, which may be why most often underestimate the impact having allergies can have on the sufferer.
There's that attitude. How bad can it be?
Yeah, exactly. Remember how some people got all up in arms when the serving of peanuts was stopped on flights? That's a pretty good example of a lack of understanding of severe allergy.
Right. That can't help allergy sufferers. Many already feel like they're inconveniencing their hosts when eating out.
Yeah, and some people just choose to stay home.
Yeah, leading to social isolation.
Yeah, it does have a far-reaching impact, and perhaps most of all, on kids.
Did you know that apparently 1 in 3 kids who suffer food allergies report they're bullied because of their having allergies?
That is awful. And it really shows the importance of educating all children about living with allergies. It has to be difficult to be a parent, managing your own anxieties about your kid's allergy while still encouraging them to go out and live as normal life as possible.
Well, Morgan Kleczewski, freelance contributor for the CBC, wrote an eye-opening piece. It's called "I'm Overprotective Because of My Son's Deadly Allergy, but he wants me to trust him. He's growing up, so I'm learning to manage my fears." She relates her own experience raising her son with a life-threatening cashew allergy. When her son was diagnosed, she educated herself so that she could best protect him, but she said that the more I learned and the more prepared I became, the more I felt overwhelmed. My fear began to control me and prevent me from trusting anyone with Simon's care besides me and my husband. I couldn't imagine sending him for a play date or a birthday party without us, let alone a sleepover. If he was invited to a play date, we would offer to hold it at our house. At birthday parties, we stuck around. Sleepovers, we just hoped we could avoid.
Yeah, it's so taxing on the mental health of the parents, but it really has to have an impact too on the social development of those kids.
Exactly. Interestingly enough, though, it was actually her son who taught her to overcome her fears. She said, as Simon grows into a brave and confident child who loves life with more zest than I have ever seen, his courageousness has slowly started rubbing off on me. He gave me the confidence to seek a solution, not for his allergies, which we eventually learned he would never outgrow, but for my mental health.
Hmm. Our next guest has had a great deal of experience treating and advising children with allergies. Dr. Adam Fox is a professor of pediatric allergy at King's College London. Widely recognized as a leader in the field of pediatric allergy, Dr. Fox is one of few in the UK with higher training in this specialty. Over the years, he has received numerous awards for his expertise and contribution to the field, including Allergy UK's Pediatric Allergist of the Year Award in 2007, as well as being featured in The Times Britain's 100 Best Children's Doctors list in 2012. Quite the accolade. Welcome to At Home and Abroad, Dr. Fox.
Thank you. Lovely to be here.
So why don't we just start at the very beginning? We all sort of have some kind of understanding or experience with allergies, and they can range from seasonal to quite severe. Could you tell us a little bit about what are the most common allergens and what dictates the severity of a reaction?
Really good place to start. I mean, we very broadly think about different types of allergies according to the way that we come across them. So, for example, we'll think about respiratory allergies, or often referred to as environmental allergies or airborne allergies. We're talking about hay fever, dust mite allergy, allergy to pets, things like that. They can be really unpleasant. They can cause a real impact on quality of life. You can be sneezing and sniffling, and that will affect your sleep, and that has a knock-on impact on your ability to concentrate and learn, on your mood, affect your exam scores, affect your reflexes in your driving, a whole range of things. But they're generally not considered life-threatening, although they are closely related to other conditions such as asthma, which is another allergic condition, which can potentially be life-threatening. And then we've got a whole different type of allergic issues relating to food allergies. So things that you eat that then cause sometimes minor issues, a little bit of itchiness and nothing too much to bother people, or all the way to potentially life-threatening and fatal anaphylaxis. What doesn't get so much press are the other things that we see: venom allergies, insect sting allergies, drug allergies. I'm a pediatric allergist, so I don't see so much of that, but adult allergists spend a lot of time dealing with that.
Within the category of food allergy, what are the most common allergens that we see there?
Well, it sort of depends whereabout you're asking for, because if we were having this conversation in Canada and the UK, then I can confidently say the most common food allergies we'll see in kids in our countries will be milk and egg and peanuts, tree nuts, and less commonly things like fish, shellfish, sesame, for example. But if we were having this conversation in Asia, top of that list, along with milk and eggs still, would be things like shellfish and fish. If we're having the conversation in Israel, for example, it's all about sesame allergy. So there's something about the infant diet and what people around them are eating that will influence what the most likely foods your allergic child will become allergic to.
That is so interesting. And I'm sure there's a great deal of research looking at the influence of the diet as an infant and that relationship.
Yeah, I mean, my own personal sort of background in allergy, my first big research study related very much to that. It was trying to understand how children became allergic to peanuts in the first place. And actually, that threw up a lot of questions. And there's now been a whole body of research around this that allowed us to come up with a model of how you become allergic to food in the first place. And then with that, it then starts to make sense why you see these different patterns in different places.
Right.
And what that model relates to is the presence of having eczema very early on in infancy. And if you've got eczema as a baby, then there is a risk that the immune system in your skin, which is not really programmed to see what's going on in the outside world, because just over the top of the immune system in your skin is your skin barrier. And that's a sheet of cells that acts as a physical barrier between you and the outside world.
Okay.
So it keeps all the germs and bugs and nasty stuff out, and it keeps all the water and nice hydrating positive things in. And just underneath your skin barrier are the cells of your immune system that are designed to keep an eye out so that if there was a break in your skin barrier, so you get a cut in your skin and those germs can get through, it's ready to kill whatever it sees.
Right.
So it's sort of programmed to be angry about stuff. Now, if you've got eczema, the underlying genetically programmed problem is that your skin barrier isn't really as tight and as good a physical barrier as it should be. In fact, it's a leaky barrier.
Okay.
And what then happens is the immune system under your skin gets a view of the outside world it's not designed to have. And so if you're a baby with eczema and other people in your family are eating peanut butter sandwiches and then kissing and touching the baby, there is a risk that the immune system in the skin will see that peanut protein on the skin barrier. And because as an infant you've never eaten peanut before, there was a risk that your immune system will make a mistake and develop an inappropriate immune response to peanuts. So when that child gets a little older and somebody gives it some peanut to eat, it will have a reaction to it. So it's all about where allergens get seen for the first time by your immune system. And if that first time is in the skin rather than in the gut, where the immune system, of course, is primed to know that whatever it sees is food, so it just needs to be ignored, that's where the risk of allergy starts happening.
That's fascinating. I had no idea that that's where the origins of those kinds of allergies occurred. So why would it be then, and maybe this is true or not true, but I understand that food allergy is actually on the rise worldwide. Why would that be the case then?
Have to be a little bit careful with this because that's conventional wisdom. And in fact, if you Google anywhere food allergy epidemic, you'll find loads and loads and loads of sort of little pictograms looking at rates of increase of allergen actually. But really, there's not much good evidence that there's more food allergy around now than there was about 10 years ago. Now, let's be clear. I'm not talking about now and 40 years ago. Unequivocally, there is way more food allergy around than there was 30 or 40 years ago. I remember when I was at school of 1,500 kids. There was one child that everybody knew about because it was so strange that he had a peanut allergy. It was really odd. The story, sadly, does not have a happy ending. This kid actually died of a fatal anaphylaxis on his way back from a year in Hong Kong. So he was actually away in a place that you would have thought that would have been the most, dangerous place for him with food labeling's terrible. And but actually it was when he was traveling back that he had an accidental reaction. And unfortunately it was an extremely severe one. Now, my son went to the same school as I did 30 years after I did. So a very easy comparison. And I can tell you now that as a practicing allergy doctor, within just a year or so, I've met about a third of his class because there were just so many children with allergy issues and plenty of food allergy issues as well. So we saw in a generation a huge change in the amount of food allergy over that sort of 30, 40-year period. And there's lots of really good evidence. I think, well, look, we all seen it ourselves, this big rise in allergy. But the idea that it's continued with an inexorable rise beyond that, actually the evidence isn't so good. And if you look at studies that look at all of the prevalence of allergies from lots of different studies all put together about 10 or 15 years ago and compare it to the more recent studies, sort of suggests that things have plateaued a little bit. But what has changed is how many people are showing up in emergency departments with more severe reactions. So now that's different to the amount of food allergy. That's actually people recognizing reactions when they happen and recognizing their potential severity. And when you dig into that data, and it's impressive. So over 20 years in the UK, and this has been demonstrated in North America, in Australia, in Europe, over 20 years in the UK, we were seeing about 6 to 7% annual increase in the number of cases of severe reactions attending A&E, accident and emergency, or emergency departments. And if you dig into those numbers a little bit, what becomes really clear is that increase is not happening amongst adults with drug allergies, medication allergies. It's not happening amongst adults at all. It's actually kids with food allergies.
Really?
So there's certainly been a much better recognition of small, families with smaller children having reactions that this is potentially dangerous and are more likely to show up in an emergency department with it. And we've got to be really careful not to confuse that increase with making the, intuitive assumption there must be more people showing up with bad reactions in emergency departments because there's more children with food allergies. It's not the same thing.
Right. So it could be attributed to a better understanding, a better education in terms of recognizing that this could be.
And that's a great thing. I mean, that's
absolutely.
I'm all for that. There's no doubt that public perception of food allergies has come. It's got a long way to go. Let's be clear about that.
Yeah.
But it has come a long way. And even in my career, 20, 25 years ago, it was. I remember going to events where family doctors at the end of it, after we talked about allergies, would come up to me and say, to be honest, I don't really believe in food allergies.
Oh, you're kidding.
It's like, well, okay, if I say I don't believe in cancer, does that mean there's no cancer? It's just you're wrong.
Yeah, exactly. There's no two ways about it. Yeah.
And I think this is one of the frustrations is that, even now we have a lot of family doctors, a lot of, doctors will be practicing, seeing kids, although I'd like to say not pediatricians. I don't think it would be fair for them, but family doctors that might have trained in the 60s, 70s and 80s where, in fairness, there wasn't much allergy around, and they certainly didn't get any exposure to around food allergies in particular at medical school. And if they've not kept themselves up to date, it's sadly possible to keep your head buried in the sand on this one.
Which could be very, very dangerous for their patients. Why do you think there was that rise, though? You spoke about your son, the difference between your son and yourself attending the school, and I've seen the same thing in my own children's schools and reflecting on my own experience. Why do you think there has been that rise in food allergy just in that one generation? Yeah,
well, I think there's two sort of important things to be thinking. So the first is there was a general increase in the amount of allergy before this. So we saw a big increase in asthma, hay fever, eczema that predated this. And given what we've just chatted about eczema being essentially a causative enabler, for want of a better word, an enabler in the development of food allergies, having an increase in eczema was inevitably going to lead to an increase in food allergy. But then the obvious question is, well, why was there an increase in eczema? Now, the conventional wisdom is all about that clean child hypothesis. So this idea that our kids don't get challenged enough by bacteria and bugs when they're little because of sanitized living conditions. And as a consequence, our immune systems don't know what to do with themselves, so they develop inappropriate responses because there isn't any cholera or typhoid to develop appropriate immune responses to. And if you dig into where that theory came from, and that theory has absolutely entered the public's imagination, and I can tell you now, there's virtually no shaking it off. It's what everybody immediately, goes for. That they're certain that's why it happened, even though there's such obvious evidence against it. I mean, you just have to look at where the highest rates of allergy are in the world. So, according to that theory, it should be the cleanest places. Well, Switzerland has a very average amount of allergy, but the lowest rate of infant mortality, etc. In fact, if you look at who is top of the list, the one thing that's really striking is not the geography or anything else, it's the culture. Because top of that list for prevalence of allergies, particularly food allergies, is Australia, the UK, New Zealand, Canada. Yeah, very, very westernized English-speaking countries seem to be sort of winning hands down in terms of preference.
That's a race we don't want to win.
No, absolutely. Yeah. If you dig into where the theory came from, it goes back to the 1980s, and there was an epidemiologist called David Strackard, and he noticed that in a large study that he had carried out, that there was a difference in the rates of hay fever according to the birth order of the children that you looked at. So essentially, he was saying that the older child seemed to be the one most likely to have hay fever, and younger children seem to be less likely to have hay fever. So the theory goes that the oldest child doesn't have any older siblings bringing all the germs and bugs into the household. So he has a very clean first few years and consequently develops inappropriate immune responses. Whereas the younger children who have got the older siblings bringing all those germs and bugs back from school and nursery, etc., they have more pressure on their immune system early on. And as a result, they're less likely to get allergies. But the truth is that if you look at different studies that looked at just hay fever prevalence, they didn't show a birth order effect. So it was not a consistent finding.
Okay.
So actually, the theory's simply got holes in it, and it doesn't really stack up at all. And it's been very much superseded by, I think, a much more likely explanation. And I'm sure you've been hearing a huge amount about microbiomes and gut bacteria, and our understanding that gut bacteria has an enormous impact on the way that our immune systems develop a relationship with the outside world. And the weight of evidence now that alongside, and remember, you don't just have bacteria in your gut, you have them up your nose, in your airway, on your skin, you have a number of different microbiomes. But I think it's becoming really, really clear that there is something around the microbiome that has changed in the last 30, 40 years, coincident with when things have changed. And it's not just allergies around things like prevalence of diabetes and multiple sclerosis and obesity and lots of other things. And of course, there are also so many different factors that influence our microbiome. And then, of course, it's not just about your microbiome. There's a healthy smattering of genetics in there that's always going to be important as well. But there's been a firm nudge towards a more allergic sort of tendency.
Right.
And that will be in people who are genetically predisposed, but now with the additive effect of these impacts of the microbiome that just essentially make us more at risk of developing inappropriate immune responses in a way that happened much less often in the olden days, where our gut bacteria were just much more diverse and I guess healthy. And it's really clear from studies now that you can tell the difference in microbiomes between people who are allergic or have food allergies and other allergy issues and those that don't. There's a much more diverse range of certain bacteria in the healthier, less allergic type microbiomes. But of course, the question of chicken and egg remains. And we need to be very careful and not get ahead of ourselves here. It might be that a certain type of microbiome and certain types of bugs predispose us to allergy, or it might be that having allergies change and influence our microbiome. And I don't think we're really at a place to say, certainly not in a place to say that we can positively intervene with our microbiome and consequently reduce our likelihood of getting allergies. And in fact, attempts to do that have pretty much failed over time.
Not had good results. Yeah, that was my next question to you, because I was just thinking, is there a way you could influence your reaction to your allergen if you were able to manipulate your gut microbiome in a more positive way? But we're not there yet.
No, there's plenty of studies have given it a go. I was involved in one a number of years ago, which was a sort of, very much that exact theory. It's essentially get hundreds of kids who are milk allergic. And we know that some of them aren't able to breastfeed and consequently are on special formulas for kids with milk allergies. So let's give half of them a special formula that doesn't have any probiotics in it, and let's give the other half a special formula that has lots of pre and probiotics. So essentially the friendly bacteria and the stuff that promotes the growth of friendly bacteria in your gut. And while some studies have shown a beneficial effect, I think this is probably the largest study of its type, and it was a big study across a number of girls across the world, a number of different centres, a very robust study, and I can attest to that personally as being involved in it. Didn't really find anything. We were hoping to show that the kids who got the friendly bacteria would outgrow their milk allergies sooner, they'd get less other allergic diseases. Just didn't show that. So whilst I think we can still say, as I said, my official line to parents in clinic will be, I've got no issue with pre and probiotics. They certainly seem to have health benefits in other areas, but for allergy, again, they won't do any harm, but I don't think we have any clear or good evidence that they're offering any benefits as yet. But there is the beginnings of a good, solid, emerging literature suggesting that dietary diversity, so having this sort of broad range of the right sort of plant-based foods during pregnancy, might have an impact at reducing the likelihood of your child having allergies. But again, it's early doors.
Okay. Well, and you know what? It's only a positive benefit to the pregnant mother anyway to have a nice diverse
Exactly. I
diet.
think
So again, can't hurt, and can only help your overall health. So allergies are most often, I think, identified early in life. Is that true? I mean, they can be identified in adulthood, but can they change over the lifespan?
Yeah, we often talk about something called the allergic march or the atopic march, which is a progression that you commonly see in people who have got those allergic genes and have just been a little bit unlucky to get whatever those signals are that mean that they go through this journey. And it starts typically with eczema in early childhood. Having eczema, as we discussed earlier, predisposes to getting food allergies. Now, many food allergies will be outgrown in childhood, like milk allergy and egg allergy. Others, like nut allergies, won't be. But as the eczema improves and sometimes those food allergies are outgrown, we start seeing those older children developing respiratory allergies and getting hay fever and getting asthma. Now, of course, anybody can be a little bit luckier and only get one part of this. So you'll get plenty of adults who will just get a bit of hay fever when they're in their 20s. And that's the only bit of allergy they get. Or you can be unlucky and get severe eczema, multiple food allergies, severe asthma, chronic rhinitis, and get the full package. And everything in between.
Yeah. Well, I know just for myself, I developed a hay fever in my 30s, just out of the blue. And I did have eczema as a child too. So could you tell me, as a parent or a guardian, if you suspect that your child might have an allergy, whether it's respiratory or food allergy, what are the steps that they should take?
I think it's going to be a different journey depending on whether it is food or respiratory. Okay. I think for food allergy, it's most commonly going to be issues as an infant when you're feeding your baby. And usually it's pretty obvious something's happened. So most people will be able to come in and confidently, say in their first clinic appointments, I gave my child peanut for the first time and they had a reaction, and describe a very rapid onset of relatively obvious symptoms. So clustered around the mouth, itchiness, swelling, hives. And if they're unlucky, it could even go beyond that. But thankfully, in early infancy, more severe reactions are less common. Okay. So there's less of a question about what was that, and more of a question of what can I do about it. And of course, the other issue is that if your infant has reacted to one thing, what else might they be allergic to? What can you do to try and prevent it? And there's a lot to talk about there. Whereas in older children presenting with more respiratory allergy, the symptoms can slowly develop over an extended period of time. So you might notice one hay fever season, they're a little sneezy and that's it. And it may be put down to a summer cold and nobody thinks more about it. But then the next year, it's a little bit more persistent and troublesome. And then it becomes apparent that it's, there's no fever and it responds to antihistamine. And actually, no, this is an allergy. It's not a summer cold. And then actually that can get progressively over time, increasingly problematic. And I don't know what you guys do in Canada, but given that we have some of the highest rates of seasonal allergies in the world, in their wisdom, our education powers that be have decided to put all the major public exams right at the peak of the pollen season.
Oh, how clever.
To maximally affect people who have hay fever. And there's been some nice studies demonstrating very clearly that if you've got hay fever, when you do your practice exams, what we call your mocks, in usually sort of the Christmas run-up, and then you have to do your main exams during the pollen season, as people have to, that if you've got hay fever, you are 50% more likely to drop a grade from your mock exams to your actual exams compared to other children. And actually, if you've been given not very good, but actually very common advice by pharmacists and advised to take a short-acting antihistamine, then you're 70% more likely to drop a grade, because often that will just make you feel even worse. So these things can have real impact on people. Not to mention the sort of the obvious symptoms of the hay fever, but often it's the effect on not being able to sleep well, which has an effect on mood, and all your cognitive skills and your exam performance.
So, Dr. Fox, having severe allergies has not only a physical, but an emotional impact on the sufferer, as well as the family. Just wondering what your recommendations are for managing perhaps some anxiety that might accompany allergies.
It's a great question. And I think one of the first things is always to be properly informed. I think most of the anxiety that I see in my clinic comes from people who have had for want of a better word, stupid things said to them. So really unhelpful things that doctors, I'm afraid, could also be very guilty of, saying to the child, looking at the allergy test on their skin and saying, wow, that's the biggest bump I've ever seen, or this is, really unhelpful things, especially when the size of the bump that comes up on their test is not in any way a measure of severity anyway. But there are some really unhelpful urban myths. So things like each time you react, it gets worse. No foundation in truth. It just isn't true. Each reaction is unpredictable, but it doesn't get worse because of the previous one that you had. And I mean, I've seen that on the television here on reputable programs with TV doctors saying, oh, and you've got to be careful because each time you have a reaction to peanut, whatever it is, it gets worse. It's just not true. But the amount of anxiety caused by, for a family where they've had a reasonably bad reaction and they will be absolutely convinced. And I see this in fact, last week in clinic, a child, said to me, will I die if I eat peanuts? And it's like, absolutely not.
Well, that's what I had heard in the past when.
Yeah, it's just
80s and 90s.
It's just an urban myth. Yeah. Wow. And I always say to people, you've got to think carefully. It's almost the same as sort of, every time you fall over, does it get worse? Yeah. No, it depends on, a million different factors, how much the food you ate, what form it was in, your state of health at the time. In truth, a huge degree of unpredictability. Now, unpredictability, of course, is always something that we're all very frightened of. None of us like that. And this is the nub, I think, of why food allergy can be really challenging, because actually really nasty reactions are very, very rare. And just to give you some context, there's been some nice work in the UK looking at your risk of dying from your food allergy, if you've got food allergy, compared to other things that are responsible for people dying. And I think it's a really helpful study to give context, because I always used to feel that just saying to a family, look, it's 1 in a million that you'll die of a food allergy. And you know what the parent is thinking. The parent is thinking, but there's only 1 in 50 kids that's got a food allergy. Mm-hmm. So my child is carrying that risk. It's like saying to an airline pilot, what are you worrying about? You're never going to crash because it's 1 in a billion to die in an airline. And it's like, but I spend all day, every day in planes.
Right.
So my risk is much higher than you, who only, flies once every now and then. So this was a study that looked specifically at people with food allergy. And they were able to demonstrate that compared to other risks, for example, that if you had a food allergy, you were more likely to be murdered, you were more likely to die in a fire, and you were hundreds of times more likely to die in a car accident. And we have to be careful because I'm not trying to be facetious here, but in truth, I would save more lives in my clinic if I gave everybody a crash helmet than if I gave them all EpiPens.
This is very enlightening. Very enlightening.
And this is hugely important for parents to understand right at the beginning of their food allergy journey. And I'm absolutely not minimizing the fact that their child has a condition that can be life-threatening. But thankfully, that's really, really rare. And it's important to get all of that in context. We know that there's far more risk every time, even if you're food allergic, every time you're getting in a car because of the risk of car accidents. Mm-hmm. So we take sensible precautions. We learn how to drive properly. We follow the rules. We use seat belts, but we don't put crash helmets on our child. And likewise with food allergy, I'm a very, very strong advocate of, really wanting my patients to get out into the world and live as normal a life as they can, but they have to take sensible precautions. And actually, those sensible precautions are not just learning about a full diagnosis, really making sure they know all the things that they're allergic to, so there's no surprises. That's something that's not always done very well. People sort of have limited testing and then get more nasty surprises and lose then consequently a lot of confidence. Understanding food labeling, speaking up for themselves, which can be hard, but is essential really if you're going to get out there, and making sure that where it's appropriate they're carrying adrenaline, so carrying EpiPens. I don't know whether in Canada they have other makes, and I'm sure we have Jext pens in the UK, and that they know how to use it, when to use it, and most importantly, they're not frightened to use it.
Okay.
Because the key thing with adrenaline is it's a fantastic medicine, but it only works if you use it. And you have to use it as early as possible. And that's why we give people adrenaline pens to carry around with them, because waiting for somebody to get there 10 minutes later may be too late. But actually, if you use it very quickly, it's extremely safe and it's extremely effective. And so the likelihood of you being sorry that you used it is pretty much nil. Whereas there's still a lot of what we refer to as hesitancy in using adrenaline pens. I always say to patients, the minute you're thinking, is this the time that I should be using it? You should have been using it. If you're even asking yourself that question, just get on and use it, because it's not a problem if you used it and it wasn't really necessary. Anaphylaxis itself, we tell people use it at the first sign of anaphylaxis. That doesn't mean that they have to start thinking through ticking boxes of, do I fulfill all of these different criteria? It's, am I worried that this is looking like a bad reaction? And if it is, just get on and use it. But a lot of parents still think of it as the sort of the nuclear option. And I think some of that is sort of denial to a degree, if like you have to accept that something bad is happening, but I'm going to have to deal with it.
Right.
But I always say to parents, you can only ever be sorry that you didn't use it.
Well, I think this is going to be incredibly important information for our listeners to hear. I've always wondered about the hereditary factor associated with allergies. And for instance, if you had a parent who was allergic to a food or a medicine, are drug reactions, like allergic reactions, are they hereditary or not?
No, they're not.
Okay.
And so having a parent who is penicillin allergic, for example, doesn't increase your risk. And this is a really interesting area, because more than 90% of people who are labeled as being allergic to penicillin, is a good example, turn out not to be.
Okay.
And if you dig into the story, it's usually, when I was little, I got an infection, I was given penicillin, and I came out in a rash.
Mm-hmm.
It doesn't take a rocket science to see where things might go a little bit wrong there.
Mm-hmm.
Because, of course, what often happens is children, as we all know, who get infections come out in rashes. And if that child happens to have been started on antibiotic, you can guarantee somebody is going to say that rash was because of that antibiotic. Right. So there was a huge amount of mislabeling that then sticks. And you will find 80 and 90-year-old people who will swear blind to you that they're allergic to penicillin, but it's based on as vague a story as that.
Well, it becomes a little bit of a mess too, doesn't it? Because people won't use this medication over their lifetime.
Yeah, absolutely. So it's a self-fulfilling prophecy, and it goes on, and then as soon as their child is on antibiotics and has a rash, it's there you go, you've inherited my penicillin allergy. So we spend a fair amount of time in our clinics doing what we call delabeling. So I always pick up with, whenever I see patients, they'll come to me rarely about their antibiotic allergies. They'll normally come because of their food allergies or their hay fever, but it will often come up, oh, and I'm allergic to penicillin. And I'll wait till the end, because I know that's what they've come to see me about. But I'll always say, just let's go back. Oh, what's the evidence for that penicillin allergy? Mm-hmm. And the overwhelming majority of the time, the evidence is very, very thin. There's usually a very, very distant story many years in the past relating to an infection and a rash. And we're able to very, very quickly delabel lots of patients. Frustratingly, in kids, allergy testing is not very helpful. So it's very hard to confirm or rule out with an allergy test, a blood test, a skin test, virtually no predictive value. So we don't bother doing them. But what we do is we take a good history. And if we're not completely convinced, we'll do the definitive test. You bring them into your clinic, you give them some penicillin in a safe place so that you can deal with the reaction if it were to happen.
Okay.
But just going back to that inheritability thing, we get a lot as well with food allergy of people saying, well, I've got a peanut allergy, will my kids have it? Right. And statistically, actually, that child is at an increased risk of having a peanut allergy compared to the next child who doesn't have a parent with one. But interestingly, when you dig into it, again, use mathematical modeling, which they've done in the US to look into this, it's nothing to do with the fact that their child had a peanut allergy, that the father had a peanut allergy that the child did. But the father who's got peanut allergy almost certainly had eczema, because that's a massive risk factor in the first place. Eczema has a very large genetic component. So there is thus a very high chance that if the father or one of the two parents has got eczema, that the child would have eczema, and then the eczema acts as a risk factor for them to then develop allergies to whatever is around them. And generally speaking, families eat the same stuff. So it's going to be to the same foods. So it's all about the eczema, the inheritability of the eczema, and it's really very little to do with the actual food allergies that the parents or the older siblings might have.
So for a moment here, I just want to circle back to seasonal allergies. I know we touched on it and how people tend to downplay seasonal allergies like hay fever as just being purely a nuisance. Just wondering, these allergies, can they ever become incredibly serious? We don't even think about it.
No, well, you don't because you haven't got it. And most people don't because they haven't got it. So Sort of prevalence in Canada, UK, 25% of adults will have hay fever. Now, the majority of them will either have symptoms that aren't that bad at all, or symptoms that, even if they are that bad, a nasal spray or an antihistamine will do the job and they'll be fine. It's irritating. And, the truth is that when you give people the right medicines, they'll often put up with the symptoms rather than taking the medicines. That's just, that's humans. But there is an important minority where it goes way beyond this. And actually, their quality of life is hugely impacted for 3 months of the year, 6 months of the year, depending on what they're allergic to, or if they've got year-round allergies like dust mites or pets all year round, and it can be a huge issue. And it can cause knock-on symptoms of things like asthma and sinusitis and chronic sore throats and headaches and all the things we talked about with poor sleep and as a consequence, mental health consequences. It can be a huge problem. And within that group, there are people who will continue to have pervasive issues despite being on all the medicines. So you can give them regular antihistamines and you give them nasal sprays and they can do all the right things. And despite all of that, it's still an issue. Thankfully, we do have a sort of second line of medication, which can be hugely helpful for that group. And I think Canada, in a similar situation to the UK, there's probably not the awareness that there should be that there are other options. And those options are typically things called desensitization. So treatments to try and make you less allergic to the thing that's causing the problem in the first place. But it does require more effort. It requires a degree of specialist input, but it can be really transformationally positive for people with allergies. And I'm a huge advocate of these treatments.
So is there anything exciting on the horizon in the field of allergy research?
There is so much going on. I often say to my wife, there's just too much excitement, and that's not a good thing. Maybe that's just a sign of my age now. It's that that there are so many fabulous things going on and so many exciting strands of research going on that increasingly recently seem to be more coming together and starting to actually come into clinical practice. And my own practice is so profoundly different now to how it was even 5 years ago, not to mention 10 years ago. And I think that's been mainly driven by, I think, two areas, really. The first being desensitization. So it's not a new treatment, it's a very old treatment. People were being desensitized 120 years ago in London. But refining it and finding its right place and finding different ways of doing it have meant that when somebody now comes to us with food allergy, whereas 10 years ago, essentially we were sort of passive partners in diagnosing people with food allergies, we're now very much active interventionalists who can offer treatment options. So oral immunotherapy, not so new anymore, offering small but increasing amounts of the food that you're allergic to, but in early childhood, can increase the likelihood of you just getting rid of the allergy, even if it's something like a nut allergy, or at least get you to the point where you're dramatically less sensitive to it, making it much less likely that you'll have a bad reaction.
How long would that process take?
Very much depends on what it is and when you're doing it, but typically, 4 or 5 months.
Oh, really?
But it comes with, as with everything in life that has real benefits, there's risks. And those risks are very real, and you can have quite bad reactions to the treatments itself, which is, an irony if you're doing the treatment in order to prevent having bad reactions and then end up causing one doing it. But increasingly, there's new ways of doing it, and that's where things get really exciting now around patches that you can just put on your skin with things like peanut on. They'll get marketing authorization in the not too distant future at all, showing interesting effects. Sublingual immunotherapy, so something we do a lot for pollen and dust mite allergies, where instead of eating the food, you squirt it under the tongue in tiny amounts, which means your chance of reacting to the treatment becomes dramatically lower. Not as effective as eating the food in terms of the treatment gain, and it takes a lot longer, but much safer. So for some patients, it fits the bill much better. And then alongside this, there's a lot of interest in what are called biologics. Now, biologics are these sort of designer drugs, the medicines that end with MAB, monoclonal antibodies, that have been developed for a whole range of inflammatory conditions, managing inflammatory bowel disease like Crohn's disease and ulcerative colitis or eczema or psoriasis has all been revolutionized in the last few years by these types of drugs. And the allergic fields very much so as well. And one of them, something called omalizumab, which was an asthma medicine that we've been using for probably the best part of 20 years. And we use it for people with what's called chronic urticaria, where they come out in hives all the time. This medicine just got its US license for food allergy because if you're on it regularly, it will markedly reduce the likelihood of you reacting to any of the foods that you're allergic to. So if you imagine you've got 25 food allergies and it's really, really hard to avoid all of them, being on this medicine will mean that for most people, 85% of people on this medicine regularly, they'll suddenly find that they can eat actually quite significant amounts of these foods without having a reaction, which means as long as they're being reasonably careful, they can, it can be really transformational. But again, there's downsides. It's an injection. You have to have it regularly, and you can have it as long as you like and then stop, and you'll just be back where you started. You'll still be allergic. And it's expensive stuff. So in healthcare systems like Canada, UK, where this is unlikely to get sort of covered by insurance, it's not really plausible. But that's not really the intention with this type of medicine. The real value is, what if we put somebody on this medicine for 4 or 5 months, and while they're on it, we do a load of desensitization much faster than you otherwise could, not having to worry anything like as much about side effects because you're under the cover of this expensive but brief medicine. And then once you've got them to the point that they're desensitized, you can wind back on the regular medicine and they shouldn't need it anymore. And then you've got somebody who's successfully desensitized to lots of things in a relatively short time frame. So all of these things are now sort of on the table and options. And so consequently, absolutely game-changing for the potential for managing. But all of these approaches have their limitations. All of this adds significantly to the complexity of food allergies. We don't have enough allergy doctors around to be able to, really spend the time to do what we refer to as shared decision making, really understanding for each individual patient, what are the allergies that are worrying them, what are the ones that they need treating, because can't overstate the breadth of opinions that you'll get from patients about having broadly the same condition. I see patients who have got certain food allergies and they'll say, do you know what? It's fine. I manage it. It doesn't interfere with my life. I'm not going to, I don't want to go through big treatments for it because I'm fine. And you'll get others who are pretty much crippled and the whole family are sort of, not going out, and they're all wrapped up in cotton wool because of the huge levels of anxiety around it. So, it's absolutely, there is no one size fits all here. But when you've got lots of options and lots of different, ways that make every family different, it does mean that it gets harder to be able to sort of just find what's right for everybody. It takes time and it takes experience, and it needs to involve the whole family. And you can't do that in a 15-minute consultation. It needs to become a much broader conversation. And that's challenging when, certainly in the UK, where there's not many allergy doctors and there's a lot of people with allergies.
Yeah, it's certainly been an enlightening conversation, Dr. Fox. You can follow Dr. Fox on Instagram at Dr. Adam Fox, where you will find a wealth of information and many of your questions will be answered, or on X at Dr. Adam Fox. Thank you. We hope that you'll return once again to At Home and Abroad, Dr. Fox.
Thank you very much for having me.
I never knew the connection between eczema and allergies. Though I never developed food allergies, I had terrible eczema. I really was a hot mess. Rashes everywhere. In the 70s and 80s, my mom and I were constantly seeking the help of dermatologists, allergists, and doctors who specialize in environmental medicine. I went from one lotion to the next, oils and oatmeal baths, and a whole lot of cortisone creams.
I struggled with it too, and so did my oldest child when he was a baby. Apparently, a whopping 9.6 million children under the age of 18 suffer with eczema to various degrees.
It is very uncomfortable, itchy, and sore. And I can tell you one thing for sure, kids aren't so kind to kids covered in rashes.
Yeah, that's terrible, Walker. Did it finally go away?
By the time I was 18, it was well on its way, and I was glad to see it go.
I bet. Hives are also a nasty business. I once had an allergic reaction to a pair of shoes, believe it or not.
No.
And the hives on my legs were so bad that I couldn't walk comfortably for quite a long time.
That is crazy.
I know.
And hives can be chronic too. I once knew someone who developed chronic hives later in life. They had a terrible time trying to determine what food or environmental trigger was causing them.
It can be really hard sometimes to figure it out, and you often need medical testing to pin it down.
Right. One allergy that seems to be pretty prevalent is latex allergy. I don't remember this one from our youth, though. Do you, Harris?
Not at all.
Yeah, latex is a tricky one. It can be found in balloons, rubber gloves, condoms and diaphragms, the elastic in pants, and pillows and mattresses.
More places than one might think.
True. Apparently, 1 to 6% of the general population is allergic to latex, and up to 10 to 17% of healthcare professionals and 33.8% of dental care professionals also suffer.
That can't be easy when their jobs require the use of rubber gloves.
Right. In fact, they're at higher risk of developing a latex allergy. And it can be just the powder inside these gloves that can trigger a reaction. So that makes it doubly difficult. Fortunately, there are synthetic gloves available. Now, were you aware that 81 million American adults and children were diagnosed with hay fever in 2021?
Are you serious?
Yes, it's pretty common. Even our fur babies can experience seasonal allergies.
Well, they are pretty terrible. The first time I had them, which was in my 30s, I think, I thought I just had the worst 3-week cold ever.
Right. Yeah, the runny nose, watery and itchy eyes, sneezing. And as we know from speaking with Dr. Fox, this is just the short list of possible symptoms.
The sneezing for me is actually the worst. And you know what? It can be really dangerous if you're driving and it gets out of control. One of my college friends actually hit a tree when she was in the throes of a sneezing fit.
Well, I heard that's actually the most dangerous thing you can do while driving is sneezing
Really,
because you close your eyes.
Yeah. And if you're one of those people who has like 20 sneezes in a row,
yeah.
you're not looking where you're going.
You're not going to pull over to the side of the road.
Yeah.
Seasonal allergy sufferers had a particularly difficult time during COVID, though, didn't they? Can you guess why?
I sure can, because I was one of them. I was constantly explaining to others from behind my mask that it was allergies and not COVID. I just felt like a pariah, and I didn't even want to go out when I was suffering. And of course, that leads to the social isolation that can be a knock-on effect of allergies, like Dr. Fox mentioned.
Well, to shed more light on the challenges that seasonal allergy sufferers experience every year, the Asthma and Allergy Foundation of America, AAFA, produces a report based on the data collected in 100 of the most populated metropolitan areas in the United States.
Oh, that's pretty interesting. So can it tell us where is the best place to live if we suffer from seasonal allergies?
Well, a little. Let me start by saying that those at the top of the list and those at the bottom are all great cities.
Okay, good to note. The very kind disclaimer, Walker.
Okay, at the top of the list of places you want to live is Akron, Ohio. Akron offers a pollen count that is better than average, and not surprisingly, the level of medication use is lower, and there's just an average number of local allergy specialists. Akron also offers a lot of great indoor activities to take part in on days when pollen counts are high.
So what other places score high on the list of livable cities for those with seasonal allergies?
Albuquerque, New Mexico, Madison, Wisconsin, San Jose, California, and Cleveland, Ohio.
Well, it's interesting. They're quite spread out. So which cities are not ideal places to live for those with allergies?
Well, low on the list produced by the AAFA were Virginia Beach, Virginia, Greenville, South Carolina, Dallas, Texas, and Oklahoma City, Oklahoma.
And I have to ask, the most challenging place to live? What is it, Walker?
I'm sorry, Wichita, Kansas.
Oh, I thought there was no place like home. Why Wichita?
Well, Wichita has higher than average tree and grass pollen, higher than average medicine use, and lower access to allergy specialists. Apparently, elm, cedar, and maple tree pollen are a few of the culprits causing the sneezes.
Well, we have quite a few of those trees around here, I just want to point out. Did you know that pollen season in the U.S. typically runs from February through November, but it can happen as early as December? So it might be a year-round thing.
Oh, man.
Yeah. Tree pollen is most prevalent in February to May. Grasses start their business in April through June, and weeds are active July through November. But hay fever or seasonal allergies are not associated often with anaphylaxis like nut medication or other allergies are, like, bee stings.
Right.
But allergies to medication are particularly deadly.
Oh, I believe it. My mom almost died in the 1980s after being treated with sulfa for a chest cold. She experienced a very serious allergic reaction called Stevens-Johnson syndrome, which is a life-threatening allergic reaction which affects your skin and mucous membranes. In her case, there was a very high risk of her dying or going blind. Luckily, she survived, but it was a nightmare.
Yeah.
Her body was so dramatically affected by the allergic reaction, so much so that even today, her skin and her nails are permanently altered.
That must have been absolutely terrifying. My sister's allergic to sulfa too. So we know allergies are a very serious business. In fact, just this past January, Orla Baxendale, a 25-year-old dancer, died of anaphylactic shock after eating cookies, which she assumed, based on the label, were safe for her to eat despite having a peanut allergy.
That's tragic. You should be able to trust food labeling.
Yes, you should. It's really terrible and very preventable. The mislabeling is still under investigation, but apparently the supplier changed the recipe, swapping soy nuts for peanuts without alerting the grocery chain's chief safety officer. And there was another case in October where Kanakporn Tangswan, a New York City physician with a severe nut and dairy allergy, died 45 minutes after consuming food at a Disney Springs restaurant. She had been assured that the food was allergen-free. And despite the self-administration of an EpiPen, she died. A medical examiner determined that Dr. Tangswan had elevated levels of nuts and milk in her system. And of course, now her husband has filed a lawsuit.
How are you to trust what you're eating is safe?
Well, as Dr. Fox says, it is rare for these terrible outcomes to occur, but it is very important to advocate for yourself, not to be afraid or hesitate to use your EpiPen, and read all labeling. He did mention sesame allergy too, didn't he?
Mm-hmm.
And sesame is one of the 9 most common foods which people are allergic to, and apparently it is becoming increasingly problematic for people. The food labeling for sesame has to be improved. It's often hidden in other ingredients and labeled as things like just spices or tahini.
Well, that makes it tricky.
Yeah, it's a big problem. There are 1.6 million people in the US right now with a sesame allergy. And did you know that many bakeries add sesame to their flours?
I did not.
I know, just another consideration. So we can really collectively support and assist our fellow allergy sufferers. We just need to all ensure that we're sensitive to their needs, the risks that face them, and we can encourage allergy-safe environments.
Well, listen to this story. It was quite the opposite. One woman's sister purposely fed her son a food he was allergic to.
No.
Yes, her sister was holding a birthday party for her son. She couldn't be there herself because she had to work, but she checked with her sister that all the food would be safe for her son to eat. Her sister reassured her that it would be.
Oh my gosh, I can't believe it.
Yeah, not surprisingly, her son had an allergic reaction to the food he ate at the party. Apparently, her sister thought it wasn't right that her son was getting special food from everyone else.
Are you kidding me? That is terrible and obviously a very serious lack in understanding, as well as empathy and respect for that matter.
Yep. So have you ever heard of the Top 9 Food Challenge?
No, what is it?
It was an attempt by Monroe Carell Jr. Children's Hospital at Vanderbilt to encourage people without allergies to gain an understanding of the difficulties experienced by those living with allergies.
Oh, like taking a walk in their shoes.
Yes, they encourage people to make their meals with ingredients which do not include the 9 common food allergens, even just one single meal, Harris. Other organizations, such as the Canadian Allergy, Asthma, and Immunology Foundation, promote a similar challenge at the end of April leading up to Allergy Awareness Month.
That sounds like a really meaningful experiment. So remind me, Walker, what are the top 9 allergens?
Milk, eggs, nuts, fish, crustaceans, shellfish, wheat, soy, and sesame.
Wow, that would be tough, wouldn't it? I actually kind of gave this a go when I was trying to figure out my gluten sensitivity, and it was not easy. It was actually quite time consuming in the grocery store and in the kitchen. But can you imagine being allergic to something that we actually need to survive?
Like?
Water.
Okay, now I'm surprised. How do you avoid water?
Right? Called aquagenic urticaria, this condition is exceptionally rare. In fact, only 50 cases have been reported. But contact with water causes itchy red hives, and it mostly occurs in women.
I can't even imagine how one would manage this.
I know. I was thinking the same thing. And I mentioned before, there are also people who experience what is known as polymorphous light eruption, or PMLE, which is an allergy to
the sun.
Yep. Exposure of the skin to the sun results in hives or a rash.
So do people with this condition have to cover up?
Most definitely. Sunscreen, wearing clothes that shield the skin, and antihistamines too.
What about the air we breathe?
Well, aside from the allergens that can be carried by the air, we don't really have allergies to air itself, but people can be allergic to the cold.
Now, I think I may have this condition.
Well, let's get into it, Walker. You might have a cold intolerance for sure. But cold urticaria is another rare condition in which exposure to anything cold, like the air or water, even what you eat or drink, can result in the typical allergy symptoms of itchiness, but even swelling and anaphylaxis.
Oh my goodness, this is actually terrifying. I only have a good old-fashioned extreme dislike for the cold, thankfully.
Thankfully, very lucky you are. Have you ever heard of exercise-induced anaphylaxis, or EIA?
Is this an allergy to exercise?
It actually is. And this, again, is a rare condition in which physical exercise can cause a severe allergic reaction. About 30 to 50% of cases are also food dependent, meaning it occurs often in combination with a specific food and exercise.
This is quite something. I have never heard of this either.
I hadn't either. And this condition can cause hives, breathing, and GI issues. But more concerningly, it also has the potential to cause a blood pressure drop, fainting, and shock.
Who would have thought that the next time I exercise, Harris, I will be counting my blessings?
Thank you for joining us at Home and Abroad with your host, Harrison Walker. If you enjoyed this episode, you would be a real gem if you would rate and review our show. It helps us to grow and expand our reach. You can also subscribe to follow us each week as we continue the conversation. Find us on Instagram at Harrison Walker or visit us at www.harrisonwalker.com. We have great merch, just saying. And of course, we would love to hear from you.